My name is Nurse Latoria Morgan, and my job today is to do a physical head to toe assessment of my patient, Mr. Eugene Morgan. Good morning, Mr. Morgan. How are you doing?
I'm doing fine. How are you doing?
I'm doing great. Thanks for asking. What can you please verify your full name and date of birth for me?
My full name is Eugene Morgan. My date of birth is 05/21/1949.
All right. Thank you. Thank you so much for verifying that information. All right, Mr. Morgan, what brings you in to see the doctor today?
I'm here for a retirement physical.
Well, congratulations. I hope I get a chance to get to that point where I can retire. All right, so part of my duty you've already done already. You mailed in your immunization record, your past and present medical history, along with your recent lab work that you had done a week prior to today, and your medication list. Okay. So thank you so much for doing all of that, and I will get all of that documented. You also provided for us a dietary intake note, which we really love because it helps us to understand how you are eating on a daily basis. So thank you so much for taking care of that for us.
All right.
All right. Are you in any pain? Are you in any pain today?
A little.
A little bit? Okay. All right. Where are you hurting?
My legs.
Your legs? Both of your legs?
Yes.
Okay. And when did that pain start?
It's been an ongoing thing for several years.
Several years? So it's been more than 3 months?
Yes.
So it'll be considered as chronic?
Yes.
Okay. What makes that pain worse?
Walking.
Walking. Okay. And what makes that pain better?
Sleeping.
Sleeping. All right. If that's what you say, that's what we're going with. Have you tried to take any medications or do any type of other therapies or anything like that to eliminate that pain or alleviate that pain?
Yes, I just take anti-inflammatory medications. That's on my medication list.
Yes, I did note that it was on your medication list. Thank you so much for that. All right. So I need you to rate your pain for me on the scale of 1 to 10, with 10 being the greatest pain ever. Could you please rate that pain in your legs?
4.
4. All right. So I'll get all of that documented as well. So now I'm going to explain to you what it is that I'm going to do other than doing a memory note of all of the information that you're giving me today. I'm going to be doing something that's called look, listen, and feel. That's where I'll be looking at your head, your scalp, your eyes, your ears, your nose, just every part of your body. Okay?
Okay.
Before we go any further, this is being video. Do you give me permission to utilize you in my video today?
Yes.
Awesome. Thank you so much for that. All right, then. So now I'm going to begin to do my assessment. I've already done the vital signs. His vital signs today was 98 was the temp. His heart rate was 74, respiration 16, blood pressure 132/74. Oxygen on room air was 100%. His height is 72 inches. His weight is 188. That gives him a BMI of 25.5, which is ideal range. All right, so I did just a general assessment when Mr. Morgan was walking in to the office, and I noticed that Mr. Morgan was well groomed. He was well kept. His skin color is appropriate to his ethnicity. Mr. Morgan also wears glasses. Mr. Morgan doesn't look like he is homeless or anything, but we'll talk about that later. Mr. Morgan is dressed appropriate for this southern summer weather. Mr. Morgan also appears to be the age that he has previously stated. All right, he doesn't appear to be down, depressed, or anything like that. Mr. Morgan, do you have any cultural or religious issues that would keep you from having eye contact with me?
No, I don't.
Okay, all right. So Mr. Morgan doesn't want to have eye contact with me, but we know that he doesn't have any cultural issues, okay? All right, so now we're going to begin to do the head to toe assessment. The very first thing that I will do is, can you state your full name for me?
Eugene Morgan.
All right. I need you to tell me who's the president.
President Biden.
Okay. What year is it?
2024.
And where are you located right now?
I'm at the hospital.
Okay. And what brought you to the hospital?
Retirement.
Retirement. All right. So Mr. Morgan is alert and oriented ×4. And Is it okay that I touch it?
Yes, it is.
All right, just gently just giving him a touch. His skin is intact, very smooth and warm to touch. I don't see any abrasions, any lesions. I'm looking also, I don't see any type of edema. Looking at his nail beds. Capillary refill is less than 2 seconds. All right, he does have some clubbing noted. Mr. Morgan, are you a smoker? Or have you been a smoker?
Yes.
Okay, well that will also help to let me know what's going on there. All right, so Mr. Morgan, if you don't mind, I need you to just take a look at me, please. All right, so now I'm gonna get ready to touch your hair. All right, when I'm touching his hair, I'm looking for brittleness. When I touch his scalp, I'm looking for any type of lesions, discoloration, scars, any type of abnormal growth. Trying to see if he has any dandruffs or any skin irritation. His hair looks really great. He doesn't have any alopecia or anything noted, and alopecia is hair loss. So his hair is very evenly distributed all over his head. All right, can you take a closer look at me this way, please? All right, so now I'm taking a look at his eyes. His eyes are very symmetric. I'm taking a look at his ears. His ears are symmetric as well. His nose, I'm looking at his nose. His nose is midline, which is very normal. All right, Mr. Morgan. So now that we have done all of that, do you have any questions so far?
No questions so far.
All right, then. So now that we have done all of that, I will be taking my pen light and I'm going to begin to do the cranial nerves.
Okay.
All right. So this is a part of the activity that you're going to participate with, okay? Cranial nerve number 1, that is called the olfactory nerve, and that has to do with your smelling. All right, Mr. Morgan, I need you to close your eyes for me. All right, and tell me, what do you smell?
Smell like honey.
Absolutely, this is honey. Thank you so much for doing that. All right, I need you to take another look at me, please. I'm going to be looking at your eyes. Cranial nerve number 2, which is the optic, and we're going to check your visual fields with that. We're also going to do at the same time number 3, which is the oculomotor, which we're going to check your pupils for reflex. Perla, which is pupils equal reactive to light and accommodation. And then we're going to check your trochlea, which is your extraocular movement, okay? I'm going to be doing all of that at the same time, okay? And we'll check your trigeminal nerve. All right, so the first thing I want you to do is look straight at me, please. Let me know if this pen light irritates you.
No.
All right, his pupils are round, reactive to light, bilaterally. His sclera is white. I've already washed my hands. I'm sorry. I washed my hands, put my gloves on, because now I'm getting ready to touch his mucous membrane. So then, can you take your glasses off for me? All right. Also, I'm going to take a look at his eyebrows and his eyelashes. His eyebrows are kind of thin. His eyelashes are kind of thin as well. So now I'm going to look at his conjunctiva. Oh, that looks great. It's really pink, moist. All right. All right. Do you wear your glasses just for reading?
Just for reading.
Okay. All right. So I've already stated that his pupils are equal, reactive. Lord. Stop. Pupils equal, brown, reactive to light and accommodation. So let's accommodate. I want you to take a look at this pen right here and follow it all the way in for me. Okay. And now we're going to check your 6 fields of gaze. Just follow the pen light. Do not move your head. Okay. Do the same thing here. All right, all of that is within normal limits. So I thank you so much for assisting me in doing that. All right, so now I also want to make sure that your septum is your nose. Just want to make sure that it's not deviated. So what I need you to do is take a sniff for me. Okay, good, good, good. All right, good airflow going through both nostrils, and that is awesome. All right, so also I'm going to be taking a look at his skin, of course, and his face. His beard is well manicured. He does have some alopecia noted in his beard. Have you ever had any chemo or radiation treatment?
No.
Okay, okay. So I will document that he does have alopecia noted in his beard, but other than that, his beard is well grown. All right. Now, what I want you to do is the abducen as well as the facial muscles is what we're going to be, nerves, what we're going to be taking a look at now. So what I need you to do is frown up for me. Frown your forehead. Frown your forehead. All right. Puff your cheeks out. Can you smile? Can you frown? Let me see you puff those cheeks out again. Awesome, awesome. Okay, so all of those nerves are functioning the way that they're supposed to function. So thank you so much for doing that. The next cranial nerve is the vestibular cochlear nerve, and this one is talking about your hearing. So what I'm going to do is I'm going to come beside you, and I'm going to whisper something in this ear, and then I'm going to whisper something in this ear. Okay?
Okay.
Tell me what you hear me say.
5.
Okay, I'm sorry, let me move this chair out of our way. And we're gonna do it again.
7.
Awesome, awesome, awesome. Thank you so much for participating with that one. Now we are doing something called the glossopharyngeal, and this is where I'm gonna check your gag reflex. I'm not gonna do it for real, but what I do want you to do is open your mouth and say, ah.
Ah.
His uvula is midline the way it's supposed to be. If I was going to check it, I would have like a tongue blade and I would place it in, and that would initiate a gag reflex. That's normally the sound that they make, okay? All right, so while we're in your mouth, I want you to go on and I want you to swallow for me. Okay, do you have any problem swallowing?
No, that's what I
Okay, awesome, awesome, awesome. So now we're going to look at that vagus. We're talking about the vagus nerve. It has to do with your swallowing. On your tongue, in different areas, is the area where you can taste bitter and sweet. Are you able to taste bitter and sweet when you're eating different foods?
Yes.
Okay, awesome. Well, that is a wonderful thing. All right, now we are gotten down to number 11. Number 11 is the accessory muscles. And with the accessory muscles, I'm going to place this to the side. What I want you to do is turn your head towards my hand. Okay, let's do it over here. All right, everything is within normal limits. All of his nerves and stuff are responding the way that they're supposed to. That is great. All right, I'm pushing down on your shoulders. And what I want you to do is shrug for me. All right, good. Okay, don't break my arm. Thank you so much. You're so awesome. All right, we've already did number 12, but just for the record, it's called the hypoglossal, and this is where I ask you to lick your tongue all the way out. All right, a lot of people cannot lick their tongue all the way out. It deviates to the left or to the right, but yours was straight midline. Lick it back out again. Don't get me excited. All right, lick it to the, then lick it this way. All right, thank you so much. All right, then I'm gonna take a look in your teeth. Look at your teeth, okay? Oh, awesome. You take really great care of your teeth. How often do you go to the dentist?
Every 6 months.
Every 6 months. Awesome. All right, open it wide. I'm gonna look at them. Yeah, look at the ones. Okay, I'm looking up top at the soft palate and hard palate. Everything is intact. All right, so again, thank you so much for all of that. Can we pause? Go. All right, so now I'm gonna get ready to do what I call an assessment of some of your cardiac areas. And what I mean by that is you have some lymph nodes that are located within this area that we're going to speak about in detail. But you also have some sinuses across here. Does this feel tender to touch?
No.
All right, this is called your frontal sinuses. All right, right across the bridge of your nose, all the way across this way. Does this feel tender?
No.
This is your maxillary sinuses. Okay, so that is good. Do you have any sinus issues, sniffing, sneezing, coughing, anything like that going on today?
No, I don't.
Awesome, awesome. All right, if you don't mind, let's swivel around in this chair just a little bit so you can, and I'm gonna do this part of your assessment from behind for purposes of visual purposes, okay? Now, in your neck, you have a carotid artery. Normally, if I was doing your assessment, I would look for your jugular vein distension. And that right there, I will only look on the right side because this is where the blood actually returns back to the heart. So I would need you to tilt your head to the left for me. All right. And I don't see any jugular vein distension going on whatsoever. So then I would turn around and I would turn the bell on my stethoscope. And I'm going to listen for the carotid arteries. I'll also be listening. I'm going to palpate it first. And you only do one at a time because you don't want to cut off the circulation. And then you will listen with the bell for a bruit. All right, No bruit. Everything's within normal limits. Great job. All right, so now, like I told you, we're going to be talking about these lymph nodes. All right, we're going to start at the top, right there in front of your ear. They call that the anterior area. This is the preauricle lymph node, and I'm assessing them for enlargement or swelling because that is a sign of inflammation, or that, you know, you're trying to get some type of illness. Then I will come right behind your ear, and this is called the posterior. This is called the posterior, and then I will come down a little bit further than that, right there. That is called the occipital. All right, and then we would go to number 4. It's a little weird, but it comes up under that jaw, right up under there, and that is called the submental. And then we go a little further in, and this is called the submandible, and that's number 5. Then we come right back to this area right underneath the earlobe. That's number 7. Number 7 is called the superficial. And then number 8. Number 8 is a little different because number 8 has several branches coming off. And number 8 is called the deep cervical chain. And they're branched all the way off there. Then we come a little posterior, number 9. That is called the posterior cervical. And then we have one more, and that is number 10. And that is called in the supraclavicle area. So that's like right up in this area right here. All right. Did you feel any tenderness or anything like that while I was touching in those areas?
No.
Okay. Awesome. Good. All right. So I'm going to go back a little bit. I think I got a little ahead of myself, and I did not look up the nasal area. So if you don't mind, can you tilt your head back for me? All right. This is my pen light that I'm using. All right. It is nice, pink, and moist in there. The septum is not deviated, which is great, and we already assessed that. Also about the ears. As far as the ears is concerned, you already want to assess behind the ears, just in case they're wearing oxygen or anything like that, because it can cause skin breakdown, as well as assessing the back of the head. If they are total patients, then it's a possibility they're not being turned every 2 hours, and they can have breakdown in the back of their head. All right, so I wanted to go back just to make that known. As far as the ear is concerned, when you are inspecting the ears, you look for symmetry, which is our symmetry. You also look at the, you also want to take a look at the cones on the inside, and there should be a triangle shaped reflection, okay, when you look in on the inside of that. All right, and then I also look at that eardrum. The eardrum is not bulging. There's no drainage down there. I'm going to do it for both sides. And then to locate the tragus, there it is right there, anterior. And to Mr. Morgan, you have a cough. How long have you had that cough?
Just happened. It just started.
Just started? Okay. Are you coughing up anything?
No, not so.
All right, okay. All right. Also, you want to take a look at that tympanic membrane. That tympanic membrane, when you're doing your assessment, should be translucent. You should be able to see through to the other smaller parts of the ear. And then it also should be shiny and pearly. Okay. We've already done the Weber hearing test. We've already done the frontal as well as the maxillary sinuses. We checked the gag reflexes. And now we're going to go on down to the neck. I started by saying that we were going to assess the carotid arteries. You cannot do both of them at the same time. You have to do it one at a time because you can cut off the circulation. So, of course, we did that there, and we did it again here. Okay, and it's palpable. It's palpable. Now, I want to take a look at the jugular. We talked about earlier the jugular vein. You want to assess for a jugular distension. That means that there is some type of obstruction going on. This is the way the blood returns to the heart. So this is the only side that you will see that distension on. Mr. Morgan, can you tilt your head to the left for me? All right, thank you so much. So I'm just taking a look. Normally we would do this when they're laying down and at a 45-degree angle because you can see it a lot better. But as of right now, I don't see any jugular vein distension at all. Okay, now you can just relax. Now I am going to assess the trachea. Let's make sure that it is midline. While I'm doing that, I'm also going to ask Mr. Morgan to swallow because that's when I can feel the thyroid gland the most. Mr. Morgan, will you swallow for me? Okay, the thyroid glands are palpable. All right, any problem swallowing?
None whatsoever.
All right, so also I'm going to come here and try to listen for a thyroid bruit. That's going to be done with the belt of the stethoscope as well. All right, there's no bruit heard. All right, so for the most part, I have completed the part of the head. Now we're going to go on down to the remaining of the body. I will continue to take a look at his skin all throughout this assessment. Although I spoke earlier that his skin is warm and dry to touch, there are no lesions. I'm not going to take his shirt off because he wanted to be kind of private, and I understand that. So there are no lesions, no discoloration. I noticed that he did have a skin tag over to his left clavicle, and I will make sure that the doctor is made aware of that. All right, so now I'm going to listen to I'm going to take a look at his chest, which I would do that from the front. And what I'm looking at is I'm trying to see the shape of it. People that have chronic lung disease tend to have like the barrel-shaped chest. So I'm looking at Mr. Morgan's chest. I'm also checking his respirations. His chest is rising and falling even. There's nothing unlabored about it, so that is good. I don't hear any audible wheezing, but also I'm going to check for his breath sounds now, his lung sounds. Okay. All right. And I'm going to switch it over. All right. And I just need you to take a deep breath in and out. Okay. And I go from side to side. I go down. I go down, back over. All right, so now I'm already here. So instead of me just jumping to the back and listen at those sounds, I'm gonna go on and I'm gonna listen at his heart sounds as well, since I am already here. So the very first heart sound, of course, we have 1 and 2 ribs here, but unfortunately 1 is what we call invisible. So we will go in between that space and I will start listening here. And this is where I will hear the lub dub. Okay. And then I will go second intercostal space. Okay. Mitral valve. Let me say it right now. I'm wrong. I went blank. I'll go back and tell you the heart sounds in a minute. But I know this is the herbs point. And then mid-clavicular, 5th intercostal space, is where you can hear the apical pulse. And this is where you would need to listen for 1 full minute. All right. Now, since he's already has his back to me, I'm going to go on and start listening to his lung sounds in the back. You don't supposed to listen to lung sounds on a bony prominence. So we're going to come more inside, that's closer to the spine. And we're going to start to that left side. Then the right. Deep breath for me. Down. Keep going. A little out to the side. And then a little further out to the side. All right. So now that I have done that, I will, like I told you earlier, we've already did the assessment of the skin. So now I will come around to face Mr. Morgan, but I'm going to try to do it from the side so that you can see the actual assessment. Mr. Morgan, can you hold your arm straight out for me? All right, there's no tremors or anything noted. All right, so what I need you to do is, I need you to flip your arms out this way. All right, so while he has his arms out that way, I'm going to check his brachial pulses. All right, +2. Radial. +2. I'm going to give you 2 fingers. Can you squeeze those 2 fingers? Okay. Strength is equal bilaterally. All right, thank you. All right, I need you to put your hands back up for me. Straighten them out. Don't let me push you away. All right, now try to push me away. All right. Mr. Morgan is very, very strong. He is very, 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 very strong. All right, so take a break. All right, earlier I mentioned that I was going to check the trigeminal nerve, but I just ran straight over it. So when you're checking the trigeminal nerve, you are going to come to that little socket area right up in there and just have your patient to clench down. Okay, and I feel a nice little bulge that comes out there that is within normal limits. Okay. All right, so now we are down to assessing the reflexes. We have the bicep, which is in this AC. We have the brachial radius, which is about 2 fingers width above the actual thumb. And then we have the patella, which is midline of the kneecap on both sides. And you have the Achilles, which is posterior but above the heel. All right, Mr. Morgan, what I need you to do for me is flex that arm for me. This is gonna help me to find that nice little bulge there. All right, and what I'm gonna do is I'm going to hit you, but I want you to try to relax as much as you can. Go ahead and try to relax. All right, and I'm just gonna strike it. All right, good. And then I'm gonna come here. This one right here was the bicep. This one is the brachial radialis. A couple of fingers up. Okay. All right, great. Now we're gonna go back this way. This is where you can find the tricep, which is right above the elbow. So I ask you to flex it for me. Good, and it sticks out really, really good. Now try to relax it in my hand. All right, and I strike it. All right, thank you so much. Now I will come on down to the patella. What I'm gonna ask Mr. Morgan to do is just relax. No, keep your, yeah, there you go. And I just want you to relax that in my hand, okay? Midway of that patella. Good job. And then we're gonna come back here. Just rest your leg in my hand and relax it. Right above the heel, posterior. All right. And I'm gonna do the same over here. We'll start with the brachial. All right. All right. And then we'll go on down to the brachial radialis. All right. The tricep, right above the elbow. Relax your arm. All right. And then we'll do the patella. Relax your leg in my arm, my hand. Relax a little bit more. All right. And then we will come back posterior above the heel. Relax your leg. All right. All of his reflexes, deep tendon reflexes, are 2+, which are normal. Whew. Now, Mr. Morgan, because I'm getting ready to assess your abdomen, it is best that we do that when you transfer over into the bed. All right, so you just act like this nice little comfortable area here is made just for you. Please don't fall. All right. So now, of course, he's keeping his clothes on, but we're gonna still walk through this process with him. So if you want to locate, I'm gonna stand back just a little bit. If you want to locate the liver, you can find the liver, which is in that upper abdominal area, and it kind of goes across the midline area. All right, and so I did his measurements already, and it was 5.5, and I guess that's within normal limits for Mr. Morgan. And then if you're looking for the spleen, it's gonna be in that left quadrant. If you're looking for the stomach, it's gonna be a little bit above that spleen area. If you're looking for the appendix, it's gonna be in the right lower quadrant. All right, something that they use to assess if a patient is having appendicitis is locating the McBurney's point. And it's not so much of the tenderness that the patient may feel when you do this, but it's the rebound tenderness after you let it go. They tend to get excruciating pain. Mr. Morgan, when was your last bowel movement?
This morning.
This morning? Okay, is that normal for you to have one every morning?
It's normal.
All right, great. Any blood in your stool?
No blood.
Any mucus in your stool?
No mucus.
All right, thank you so much. All right, so now as far as when we're getting ready to do the assessment of the abdomen, we look first. What I'm looking for is, I'm looking to see if his belly is round. I'm looking to see if it is distended. I will also feel or palpate to see if it's distended. Are you having any abdominal pain right now?
No, I'm sorry.
All right, so because he's not having any abdominal pain right now, I can start at the right lower quadrant, work my way up to the right upper quadrant, go over to the left upper, and then go below that to the left lower quadrant. All right, so if you wanted to talk about the intestines just for a little bit, the intestines, you have the ascending, transverse, descending, and your sigmoid. That's where your colon is located. So I'm going to take a moment and just take a look at his skin. All right. So when I took a look at Mr. Morgan's skin, of course his skin is warm and dry to touch. I'm going to go on and touch underneath and looking and feeling for any hair distribution. He has very fine hair noted on his chest and a little bit around his navel. His navel is located in mid-abdominal area. I'm going to assess for the hair on his arms, and he doesn't have any. Okay. All right. So take a break. Before I get a little ahead of myself, I asked Mr. Morgan I was assessing his range of motion, but I did not complete his range of motion. So Mr. Morgan, if you don't mind, can you place your arms straight out like this for me? All right. So what I need you to do is, what I don't want you to do not let me push you down. Okay. All right. Now I'm going to do this right here. Do not let me push you up. Good. Good. Straight, equal, even, bilaterally. All right, so we've taken the time and we've done that. Now, while you're sitting there, what I want you to do is, you can relax your arms. His range of motion is within normal limits for him. He did not show any facial grimacing or complain of any pain during that part of the assessment. So now we're going to do the same thing, but we're going to do it with your thighs, your knees, your legs, and your feet. Okay? All right. So what we're going to do is, what I want you to do is lift this leg up, but I'm going to try to push it down. Great. Lift this leg up. All right. And what I want you to do is take your thighs and roll them outwards for me. Is any of that uncomfortable for you?
No.
Okay. Roll them back in. All right. So now what I want you to do is, don't let me push your legs down. Good. Don't let me pull them up. All right. So I'm going to check this dorsal pedis pulse here on the top. I'm going to do it again on this one. And then I'm going to come here, posterior tibia. All of these are +2. I'm checking the capillary refill in his toes. There's no edema. There's no skin lesions. No cracking of the skin. Capillary refill is less than 2 seconds. All right, now, Mr. Morgan, we're going to lay that down. All right, so let's start right there. All right, so we're going to complete this range of motion for the upper extremities. Mr. Morgan, if you don't mind, normally I would do this while he was sitting up. Mr. Morgan, take your arms and extend them outwards and rotate your wrist around and do it backwards. All right, he has great range of motion in his wrist. Now what I want you to do is flex your arms inwards. Great job. And extend it outwards. All right, good, good. He has awesome range of motion in the upper extremities. Everything is within normal limits. All right, pause. Check the range of motion of like the shoulder area. So Mr. Morgan, if you don't mind, take your arms and straighten them out like this for me. All right, I want you to flex them forward. Then circumduct them backwards. All right, any pain?
No pain.
All right, no pain, no popping. Everything's within normal limits. All right, stop. All right, so I'm going to continue with my assessment on the lower extremities. I'm going to palpate for a muscle tone. He has really great muscle tone. All right, I am palpating his skin. It is smooth to touch. No edema noted in his knees along any bony prominence. No hair noted on his legs. Same thing over here. No edema. No edema noted. Skin smooth. And the color of his skin is appropriate to his ethnicity. So I totally forgot all of the locations of the heart sound, so I'm going to go back to that point. After we do that, then we'll assess for the femoral pulses. We'll assess for the popliteal artery and pulse, and then we'll go down and we'll do a few more other range of motion exercises, and we'll be ready for the chest and the abdomen. So I'm going to put my stethoscope on. All right, so on the right side, you have the right second intercostal space. It's the aortic valve. You go over to the left side, second intercostal space, the pulmonic valve. You come inward to the left sternal border, third intercostal space. That's the Erb's point. Then you have the tricuspid, which is located left sternal border, fourth intercostal space. You go over mid-clavicular, fifth intercostal space, and this is called the mitral valve. All right, so I'm going to demonstrate the posterior pulses on myself for the sake of privacy. So you go into your groin area and you palpate. It's a little deep palpation, and that's where you can locate your femoral pulses. All right, back here, which is posterior, lateral area. This is the pulse that is behind your kneecap. It is also called the popliteal. You have to kind of palpate a little hard, maybe put your thumb on the kneecap and palpate there. All pulses are 2+, even, equal bilaterally. All right, so we're going to do a few more range of motion exercises. Now, what I need you to do, Mr. Morgan, is place your feet in an upward position for me, and I need you to rotate your ankles. Okay, is that uncomfortable for you?
No.
All right, so now you're going to do something that's called plantar flexion, and that's where you're going to flex your feet out. There you go. And then dorsal, you're going to do the dorsal flexion, which is inwards, flexing inwards. All right, any of that uncomfortable for you?
Not at all.
All right, we've already extended your legs. We've already abducted. We've already adducted. We've done all of that. All of your strength, pulses, flexions, everything is within normal limits. All right? We can quit that. So, I did leave this part out when it came to the chest. You are supposed to palpate for any type of crepitus, any type of masses. You look at the skin, the color, the texture. Check the skin tugger on both hands. They are less than 3 seconds. That will helps us to detect dehydration as well. All right, and I don't feel any masses or any pulsations in the chest area at all. Again, I said that he had very fine hairs located on his chest. Okay, our next is the abdomen. All right, now we are ready for the abdomen. I'm going to inspect. The very first thing I'm going to inspect for is the contour. I'm going to be looking at, like I said earlier, the stomach to see if it's round, if it's flat, to see if it's distended. Then we'll assess the bowel sounds, and we will locate some organs. I think we located some organs earlier, but we'll do them again if we have to. All right, so now I will visibly look for any type of visible masses, and I don't see anything. No herniations. You can have an umbilical hernia. Texture of the skin. I don't see any moles, no scars, no bruises. I don't see any of that. So the abdomen appears to be very, very healthy. Everything within normal limits. Now, I would like to listen for aortic brewing. I'm going to have to do that with the bell of my stethoscope. got my bell. Oh, won't stay in. All right. I go to my umbilical and go up. I'm going to put 3 fingers above the umbilicus. Then I put my stethoscope above that, and that's what I'm going to auscultate for abdominal aortic bruit. And I do not hear one. That's good. All right. The renal arteries. We got 2 fingers above the umbilicus. And this will be the left renal artery. Okay. And this is the right renal artery, directly across from the left renal artery. All right. Down, 2 fingers, left iliac. It's going to be the right iliac. Right iliac is directly across from it. Then everything is fine. Everything within normal limits. I didn't hear any bruise, so that's a very good sign. So then I will flip the head of my stethoscope around because now I'm going to assess for bowel sounds. And we always assess before we palpate because we don't want to disturb anything. And then begin to hear some background noises. Okay? So I will start with the right lower quadrant. Put this in my ear. That's where the ileum is. And it's good to listen for a full 5 minutes if you can, or at least to hear 5 good gurgle sounds. And then you go up to the right upper quadrant. You go over to the left upper quadrant. Then you go down to the left lower quadrant. All right, bowel sounds present times 4. They are active. All right, just a moment.
Go.
All right, so now I would do what they call percuss. And I will percuss through the whole around, like a circular area around the abdomen. And I would do that by placing my hand here. If any of this is uncomfortable or painful, just let me know. And then I would tap. And you can hear a different sound when you are percussing over an organ versus when you're percussing over just some empty space. Stop. All right, so now I am going to palpate the abdomen. And I'm going to start off very lightly because, again, if there's any discomfort or tenderness or anything like that in the abdomen, then you don't want to go too deep and you don't want to make the patient feel uncomfortable. So if I'm palpating Mr. Morgan and it gets too tender or starts to, bother you anyway, just let me know, okay? Mm-hmm. So I'll start off light. And I like to go in a circular motion. And I'm going up. I started in the right lower quadrant, right upper quadrant. Come to the left upper quadrant. And over here is where that old spleen and stomach is located. Then the left lower quadrant. Any discomfort?
No.
I didn't feel any masses. I didn't feel any wave-like sensation, no pulsations. Do know and understand that if you are ever palpating or feeling the abdomen and you feel a pulsation, you need to stop because that is a very clear sign that there is a rupture in the aorta and you can cause some massive bleed. All right, we're going to stop right there. All right, initially I did the light palpation. Now I'm going to go a little bit deeper. If this gets uncomfortable, Mr. Morgan, just let me know. And I go in a circular motion. Started at the right lower quadrant. And everything is within normal limits. There are certain organs you are supposed to be able to palpate. There are certain organs you are not supposed to be able to palpate. So earlier I spoke about the liver and the 5.5 inches. And the stomach in this location, also that liver kind of goes from the right upper quadrant across the midline area. But it also depends on the person and their lifestyle. If their lifestyle was filled with alcohol or drug intake, of course their liver is not going to be the normal size. All right, so I made this part last but not least, and that is checking the spine. There are several things that you will be checking when you are assessing the spine. You're going to be checking for the S curvature in the thoracic area, S curvature in the lumbar area, and all of those are indicatives of scoliosis. All right, right across where the scapula is, you will see in some people what they call humpback. But in medical terminology, we know that as kyphosis. Also, when you go to the lumbar area, then sometimes there is an outward S curvature, and that is called lordosis. So the way that I'm going to also assess the skin, but also inspect the spine at the same time. Mr. Morgan, can you bend at your waist? If it gets uncomfortable, just bend to a comfortable position for me. All right, so then I would just lift up his shirt and I'm gonna palpate his spine. There's no S curvature known. Okay, no S curvature. The skin, I told you earlier that he has a skin tag noted, and he has like a little lymphoma noted on the left scapula as well. Other than that, the skin is intact, warm, dry. There are no particular lesions or anything like that, no abnormalities. Skin is intact and within normal limits. All right, so then, like I said before, I would take a look as well as not only palpate, but I would take a look and I would lay my hand on the scapula. Go on and bend back over for me again. Okay, my hands are level on both sides. If they are not level on both sides, it would be an indicator that there's possibly some spinal curvatures. I will come down and place both of my hands on his hip. Both of my hands are level on the left as well as the right side, so he has no abnormal spinal curvatures at all. His spine is intact and within normal limits. All right. Thank you, sir. Hold it. Make sure I did everything. All right, Mr. Morgan, first I would like to say thank you so much for participating with my activity today. But I do have some health maintenance concerns that I would like to express with you. I want to ask you, do you have any constipation or diarrhea that you know of?
No.
You told me that you had your bowel movement today. You normally have it once a day. Is that still correct?
Correct.
All right. When was the last time you checked your prostate? When was the last time you had your prostate checked?
Oh, I have it checked on a regular basis.
Are you seeing a urologist?
Yes.
Awesome, awesome, awesome. Anytime your PSA level starts to elevate, make sure that your primary care physician is referring you to a urologist. That is very, very important. Okay, so I want to make sure. I did see that you already saw your urologist when I looked at your health and assessment packet that we sent you. Mm-hmm. Also, colonoscopy. Have you had a colonoscopy in the past 10 years?
Yes, I had.
Awesome. And did they find anything?
No, they didn't.
That is great. So I'm pretty sure that we will help you to keep up with that. Have you had a Cologuard or a stool sample kit mailed to your home?
Yes.
Okay, that is great. Make sure that anytime that is mailed to your home, that is not exempting you from having a colonoscopy, but yet it is also giving your provider a look to see if you're having any type of blood noted in your stools. When you wipe, do you have any blood in your stools that you know of?
No.
All right. Last question. Testicular exam. Are you getting in the shower and checking your testicles?
Yes.
That is the best time to check them because the temperature of the water will help expose any abnormalities. Have you felt any lumps, masses, lesions, bruises, anything like that?
No.
All right. Do you have any bruises or anything else that you would like to express with me?
No.
All right. So I thank you for doing your you did your immunization record, and I thank you for that. Did you have chicken pox when you were a child?
Yes.
All right. What about measles, mumps, and rubella?
Yes.
Okay. I see that you did put that information on there. Tuberculosis, have you ever had that?
No.
All right. So I did see that you had a little cough. or whatever. I will make the provider known for that because sometimes the cough is just that, it's maybe some postnasal drip, but sometimes it's a little something different. So I'll see if you want to do anything concerning maybe a chest X-ray or something like that. Okay. Do you have any respiratory issues in your family?
No.
Okay. All right. So that's a good thing. All right. Have you ever been exposed to any molds, asbestos, or anything like that?
No.
All right. So you said that you're retiring. So the money that you bring in, Mr. Morgan, is that more than enough to take care of you, your expenses, as well as your health insurance?
Yes.
All right, Mr. Morgan. Do you use any street drugs?
No.
Do you overuse any medications that's been prescribed to you?
No.
All right, great. Do you take all of the medicines that you've listed on your form?
Yes.
And do you take them as prescribed?
Yes.
All right. Do you drink any alcoholic beverages?
Once occasionally.
Occasionally. Okay. So occasionally, is that once a week, twice a week?
Twice a week.
Twice a week. And are you drinking 1, 2?
1 or 2.
And what's that beverage of choice?
Wine.
Wine. Okay. And what's the ounce on that wine? Is it 6, 8, 10, 12?
6.
6. Okay. That is a good recommendation. So you're doing well with that. Do you smoke?
Occasionally.
Occasionally. And what's your preference?
Cigars.
Cigars. Okay. Do you have a cigar every day?
No.
Do you have a cigar? How often are you having your cigars?
Weekly.
Weekly. Okay. And what about vape? Are you using any of those electronic cigarettes
No.
or anything like that?
No.
All right. Great. 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 All right. So also, a lot of men do not think that they're at risk for breast cancer, but you are, because you do have breast tissues in your chest area. When I was doing my assessment, I didn't palpate any masses or anything, but also you need to be assessing and palpating your nipples because sometimes you can't have a discharge.
Mm-hmm.
You ought to do that once a month, just like the ladies do. Okay?
Okay.
Have you been doing it already?
No.
All right. Well, I think it would be great if you can start doing that because men are just as at risk for having breast cancer as women are, and especially because you are smoking cigars. Okay?
Gotcha.
So we want to make sure that we are crossing all of our T's and dotting all of our I's to do the best that we can to take care of you. Do you need any medications renewed or refilled while you're here?
No.
All right. Is there any referrals or consults that you would need for us to put in for you?
No.
All right. Well, thank you so much. You have been an awesome patient, and I really appreciate your time. You have a wonderful day, and I'll see you. The doctor's going to go over the lab work with you as well. I see you already had it done a week ago,
Yeah.
but I'll document it in your files, okay?
Okay.
All right. Anything else?
No, that's it.
Have a great day, Mr. Morgan. Thank you.
Yeah, you're welcome.
Mhm.
Thank you.